What a wonderful, wonderful, what a wonderful world. What a wonderful, wonderful, what a wonderful world. What a wonderful world. I see trees of green, red roses too. I see them bloom for me and you. And I think to myself, what a wonderful world. I see skies of blue and clouds of white. What a wonderful world. Colors, colors, colors of the rainbow in the sky are also on the faces of people going by. Nothing but shaking hands, saying, how do you do? They're really saying, I love you. My dear baby, I watch them grow. They'll never know that I'll never know. And I think to myself, what a wonderful world. I see trees of green, red roses too. I see them bloom for me and you. And I think to myself, what a wonderful world, what a wonderful world. And I think to myself, what a wonderful world, what a wonderful, wonderful, what a wonderful world.
Absolutely brilliant. Well, good morning, everybody, and a very, very warm welcome to you. I'm John Surrigan. I'm Executive Director for Place for Dorset Council, and it's my great privilege and pleasure to give you a really warm welcome to the Carers Dorset Festival this morning. A particular welcome to all of our unpaid carers, because this is your festival, our opportunity to thank you, to celebrate that all that you do, and enable you to network and share with each other your experiences in supporting each other, those that you care for and the community that you work in, and just to say how much we do value and appreciate all that you do. Now, I know that looking at the programme, some of you may have expected Matt Prosser, Dorset Council's Chief Executive, to be welcoming you this morning. Matt does send us his very best wishes, but apologises for not being with us this morning because he himself is caring. He's currently supporting his wife, who are both caring for his mother-in-law, who's sadly in the final stages of her life. And we send Matt and Cheryl our warmest wishes this morning. And I know that everybody on the call this morning understands the role which Matt is playing at this time as a carer himself. In a few moments, I'm going to be handing over to Johnny and Tiggy Walker, our very special guests, and we do thank them for giving up their time to be with us this morning. And of course, known to many of you as patrons of Carers UK. I don't think in reality, Johnny or Tiggy and their voices need any introduction, because both have been involved in national and local radio, and indeed, for those of you like me, old enough to remember, also in pirate radio, but perhaps more of that later. Let me just address the key feature of the festival this morning. Caring is, of course, such an important role and a role that you all play as unpaid carers. And that is absolutely vital to holding our community together. And I think through COVID, it's come home so clearly to all of us just how important it is that we do all support each other. And your role as unpaid carers doing that day in, day out is so, so critical to ensuring that our society remains functional. As a family myself, I've also had personal experience of being a carer. My wife and I over recent years have both been involved in caring for elderly parents and supported 3 of them through the impact of long-term conditions before they themselves passed away. And of course, this is an experience which touches so many of us, as it does, of course, for Matt this morning. And it's for this reason that we can recognise the part that unpaid carers play. So many of us have had that first-hand experience. And it's for that reason that we can humbly say thank you to all of you who do this on a regular basis. So let me hand over to the series of video presentations that we're going to see in the next series of slides. So first, we've got a presentation from Liz Hutchinson. I think a number of these are coming in pre-recorded, but nonetheless, you should be able to hear those loud and clear. So if somebody would just like to run the first of those, I'd be grateful.
Hello, my name is Leslie Hutchinson and I'm the Corporate Director of Adult Care Commissioning with Dorset Council. I'm so glad to be able to be given this opportunity to just say a huge thank you to all the carers in Dorset. Hello, my name is Leslie Hutchinson and I'm the Corporate Director of Adult Care Commissioning with Dorset Council. I'm so glad to be able to be given this opportunity to just say a huge thank you to all the carers in Dorset. We are so grateful for everything that you do, and today is about you and celebrating that. We know it's not been easy, particularly during COVID. We are here to help and support you though, so anything we can do, please don't hesitate to get in touch. Thank you once again and enjoy the festival today. Bye-bye.
Thanks, Leslie. And we're now going to hear from Sam Crowe, Dorset's Director for Public Health. And Sam, I think, is coming to us live.
That's right. Good morning, everybody. So I'm Sam Crowe. I'm the Director of Public Health for Dorset and also BCP Council. And I'm delighted to be joining you this morning just to give you a quick update on COVID, but also, again, to thank you for everything that you've been doing over this extraordinary past couple of years. I'm also joined this morning by Jane Horn, who's one of the consultants in public health who works in my team. And Jane's going to talk us through some of the updates that we have around the availability of things like the booster vaccination and what you should be doing to look out for that appointment, because demand is very, very heavy at the moment, but we've got some points that we'd like to share with you. But I think first, my main message today is one of recognition and respect for everything that you do. It has been an extraordinary 20 months, and I was reflecting on the impact of those with caring responsibilities, which was felt very strongly by myself and also by the public health team. Right at the start of lockdown, my father was in a nursing home in Macclesfield, and I'd been going up regularly to support him through his end of life period as he was struggling with vascular dementia. He sadly died just before the first lockdown, but at least I was able to visit him through that period, and I was also able to arrange a funeral, albeit a very quickly arranged funeral. But it does bring home just how difficult that period was when the country then shut down. And as a public health team, we found ourselves at the forefront of one of the most extraordinary interventions that we've ever had to do. When effectively the care sector had to shut down, we had to stand up testing, we had to develop infection prevention and control procedures, which was out of our comfort zone because this is not something that public health teams and councils were used to doing, and it's outside of our responsibilities. And probably the hardest thing that I ever had to do was to write to the sector and to impose those restrictions on visiting because of the risk of spreading COVID. It was a very, very difficult time. And I felt that personally, and I know that many of the team also felt that professionally as they were supporting the sector. Could I have the next slide, please? So I just wanted to say thank you, and we acknowledge that obviously the role that carers has played was never more important than during the pandemic, and we couldn't have done a lot of our public health response without not only working with carers, but the voluntary and community organisations that stepped up and made sure that that crucial support was available through that extraordinary period. Next slide, please. So in terms of the local situation, this is the picture of our local epidemiology, which you can see in the bottom right, the cases do continue to rise across Dorset County, probably because we were hit less hard by the previous two waves. We're now seeing higher infection rates in the southwest than the England average, and cases are continuing to be highest among school-age children, but they are rising in all age groups, including our older age groups and the over 60s. The big difference, of course, now is that although we've got an endemic pattern of transmission, our hospitalisations are, although they're rising, they are much, much lower than they would be if it weren't for the vaccination programme. So if you look at the infection rates under BCP Council, we're currently looking at a rate of 600 cases per 100,000 in the past week, far higher than over the summer period. Dorset Council, very similar, at 570 rates per 100,000. So as I said, the infection rates are high, but the picture is different because of the vaccination programme. So as the data shows there, although we've got 90 people in hospital currently with COVID-19, that figure would be far, far higher if we hadn't managed to vaccinate as many of the population that we have. Next slide, please. So, unsurprisingly, I'm going to continue to reinforce some of those public health messages that have been so important right the way through the pandemic. The health and care system is under significant pressure, not just because of COVID, but because of this huge catch-up programme that's going on because of a lot of people that had delays to their care. And it's more important than ever to take steps to prevent the spread of the virus. So even though we've got lots and lots of people vaccinated, it's important to remember that you can still catch and pass on COVID-19 even if you've been double vaccinated. So we're continuing to provide opportunities to target rapid testing to people. You can also continue to get those kits from pharmacies or order online. And if you're going into a high risk situation, perhaps meeting up with people that you've not met for a long time or meeting in an indoor crowded space, please do test to make sure that you can pick up any asymptomatic infections as quickly as possible, and obviously follow that up with a PCR test if that's positive. Continue to take those hygiene measures. The importance of ventilation, really important at this time of year. I know it's cold outside, but if you can open a window, even just for a short period to get some air into the room, that really does reduce the risk. This is an airborne virus and it spreads very, very easily in confined spaces. I think people should be wearing face coverings in enclosed spaces, particularly if you're mixing with lots of people. Keep hand washing and remember to keep your distance if you can. And Jane's going to talk to you about the vaccination programme and how you can get that important third booster if you've been double jabbed, but also remember the importance of getting your flu jab this winter. So we were lucky we didn't have much circulating flu in the community last winter for obvious reasons. Most of us hadn't been mixing, but we are starting to see cases of flu already in the southwest. So if you've not had the opportunity to get a flu jab, please do look online and seek that out. There's lots of opportunities to get that. Next slide, please. So I'm going to hand over to Jane at this point, who's going to talk you through an update on vaccination. But thank you ever so much for inviting me today, and thank you for all that you're doing.
Thanks, Sam. And again, thank you to all our carers out there. Very important role. In terms of vaccination, locally, our COVID vaccination rates have been very high. We've got really good uptake of our first and second doses. And as Sam mentioned, we can really see that the impact that's had in terms of the significant reductions on numbers of people then going into hospital. It doesn't mean that if you're vaccinated, as Sam said, you can't catch it, you can't pass it on, you won't go into hospital, but it reduces the risk substantially. Obviously, we've had the vaccination programme has continued to expand. So we've got first and second doses for anyone over 16 now, and 12 to 15-year-olds still also just rolling out first doses to them. And of course, we've got the booster vaccine now available to anyone who's over 40 and 6 months since their last dose, their second dose. We do still have a number of people who haven't had their first dose, and the first dose is the most important one. So,
Jane, so I just mute out the background noise again, so sorry.
That's all right. So we do still have a number of people who haven't had their first dose, and obviously that is the most important one. You get most benefit from your first dose, more benefit than additional benefit from your second dose, and your third dose provides a kind of a top up. So if anybody out there hasn't had their first dose and is keen to get that, the offer is still open. Please do seek out that opportunity. We have delivered more than 1 million doses of vaccine in Dorset, so that's really great news, but we continue to deliver more. It is very busy, as Sam said, and there are a number of ways that people are being invited for their vaccine. So people are able to go onto the national booking system and book for vaccine through that route. That is very, very busy. And as soon as appointments go up on there, they are being snapped up. So that is a challenge, and we continue to make appointments available through there. But because those booking slots aren't then also ring fenced for local people, they can be used by anyone, and indeed anyone from within Dorset can go to any booking, any site that's on the booking service, regardless of whether it's in Dorset or not. That does mean we have chosen to actually focus our appointments and do those locally so that we can make sure they go to Dorset patients. So GPs are not using the national booking system. The primary care networks and groups of GPs working together are booking slots in, and they're doing that focused primarily on who is most at risk. So they're working through those people most at risk and providing offers of vaccination to them. So those will be coming through, but it does take a bit of time to work them through. As I say, it is very busy. Some of the patients, the housebound patients, for instance, take a bit more time because you have to actually go out to them rather than bring them in. So, that is why it is taking some time. Next slide, please. So just again to reiterate, those who are eligible for the booster, if you are able to book through the national booking system, you can do so from 5 months after your second dose, but you won't be eligible to get the actual dose until 6 months afterwards. We are highly recommending that you do it as a book-in. We have very limited walk-ins because we are trying to focus our appointments on those who need it most. By booking in advance, you make sure you can get your jab at a time and a place that's convenient for you. Again, as I said, demand is very high. So if you are using the national booking system, do check back regularly because the appointments keep being updated. And we have already given 160,000 booster doses in Dorset so far, and will continue to do so. So really, really good work by the whole system, all of our doctors and nurses, but encourage you to take your booster up. And as Sam said, encourage you also to take your flu if that's offered to you. Thank you. Hand over to the next speaker.
Thank you, James. That's really helpful. I know there's a question too going into the chat bar. We're going to take a couple of Q&As at the end. So if the speakers can just have a quick look at those, and who does want to pose questions, we'll do our best to cover those at the end of this session. Festivals are a time, of course, to celebrate and to give thanks. I would just like to acknowledge the support we've had from Sam and his team. I think Sam hinted very modestly at the level of responsibility that directors of public health have played throughout the pandemic, but I can only say personally, as a colleague who's worked very closely with Sam throughout this, that the advice and guidance that Sam has given to Dorset during the pandemic has been second to none. This, as you will appreciate, on occasion has been a very, very difficult set of decisions and responsibilities that have weighed on Sam's shoulders, but he's been an absolute consummate professional throughout that, and I think we should all thank him for the support he's given us to make sure we've kept Dorset very, very safe through a very, very difficult period. So thank you, Sam, to Jane and to your team. Next presentation is from Tim Goodson, known to many of you, of course, at the Dorset CCG, and Tim is coming in virtually, so if you can run Tim's video presentation, that'd be fantastic. Thank you.
Hello everyone, my name is Tim Goodson and I'm the Chief Officer of Dorset Full Commissioning Group. The last few years have been really challenging for everyone, but particularly for carers. So I'd like to take this opportunity to thank you all for your dedication, commitment and hard work. I really hope you make the most of the day, and thank you once again.
Thank you, Tim. I'm going to come to the next presentation now, which is from Harriet Stevens. And Harriet is coming in live. I did see Harriet earlier. We said hello. That's a lovely wave on screen. Harriet, the floor is yours.
Hiya, thank you very much, John. So can everyone hear me okay?
We can hear you loud and clear. Yep.
Brilliant, brilliant. So yeah, hi everyone. So my name is Harriet Stevens, and I'm delighted to have been invited to come and speak to you all on this very special occasion indeed, as part of the opening session of the Dorset Carers Festival. I'm going to be delivering a fairly short presentation today and to talk to you about the benefits to you as carers of registering as an unpaid carer with your GP practice. So just for a bit of background, so my role title is Carers Engagement Facilitator, and basically what that means and what I do is I support all of our GP practices in Dorset, that's BCP and Dorset Council area, to look at ways we can improve how we support our patients who are unpaid carers. In order to do this, I work really closely with what we call our GP carers leads, and we have one in every practice in Dorset. We recognise in our GPs in Dorset the immensely important role that carers play, but also that carers have quite specific needs and that there's things in GP practices that we can do in order to help meet those specific needs. So as part of my role, I also work really closely with the carer lead organisations in Dorset, such as Carer Support Dorset, CRISP, and our carers caseworkers, and many more. There's lots of us, all of which you'll hear more about throughout presentations today. It's just that we're a really good team in Dorset and we work together to support our Dorset unpaid carers. Can I have the next slide, please? So the relationship between the GP practice and the carer should be viewed as a partnership in care. And what I mean by that is that it should be a two-way process where the practice and the carer can work together. Communication is absolutely key. For the carer, being open with the professional about the impact your caring role has on you is really important. The more they know, the better they can support you. And for GPs, it's vitally important that they communicate well with carers. The GP can share information with you about aspects of the care and treatment for the person that you care for. And they can also offer advice and skills that you need as a carer, such as how to change a dressing or give out medication, for example. We do need to be mindful about gaining consent from the cared for person first. Usually practices have a form that can be filled out to gain this consent. If consent is refused, the GP practice can still listen to your concerns and talk to you about information that you might already know, and they can still offer you advice and guidance to support you in your caring role. We call this common sense confidentiality. You should feel able to talk to your GP practice about what will help you. As I'm sure we all know, GPs are constantly under increasing pressure and demand, but if a change has been introduced to the practice and it negatively impacts on you as a carer, please let the GP know. They may not be aware of the difficulty this causes, so this feedback is really important. Next slide, please. So this is the main slide I'm going to be talking through today. This lists just some of the practical things your GP practice may offer to its unpaid carers. So as I said, each GP practice has a dedicated carers lead, and registering as a carer means this carers lead will be aware of you, and this person acts as a first point of contact for carers. Each GP practice should have a carers register. This is a register of all patients who are known to have caring responsibilities. Practices often provide carers they identify on this register with a carers pack, which contains lots of important information on support, advice, and services available. If your GP knows you are a carer, they can give you information, support, and advice about aspects of your caring role, such as the carers assessment, and they can signpost you to local carer support organisations or maybe carer groups that are running locally. The practice can also sometimes offer home visits, which may be particularly helpful when people have caring responsibilities and that makes it difficult to leave the house. The practice can offer double appointments for the carer and cared for person to come in together. Again, important if caring responsibilities means it's difficult to leave the person that you care for. They can arrange with you convenient appointment slots so that you can manage your caring responsibilities whilst also looking after yourself. The practice can arrange repeat prescriptions. This is quite typically available to all patients now, but of particular benefits to carers and their cared for people. The practice can support both the carer and cared for to access benefits by providing supporting letters if needed. The practice can offer its patients who are unpaid carers in-house carer support groups. These are groups often run within the actual practice or maybe in a local church or town hall where carers registered at the practice can come together to offer peer support and a chance to speak to others in a similar position. The practice sometimes can also offer carers clinics, and these are run within the GP practice itself and usually involve representatives from carer support organisations such as CRISP or Carer Support Dorset, who can offer advice and support to carers on a one-to-one basis whilst in those clinics. Since the pandemic, some of the surgeries have actually run these on the telephone. The practice can offer annual wellbeing reviews to carers. The wellbeing review will check if the carer is still carrying out a caring role, how the carer is coping, and whether they need further support, advice, or guidance. And making the practice aware you are a carer means you can receive priority for the COVID vaccination under cohort 6. That is, of course, if you do not qualify for priority under earlier cohorts anyway. And lastly, all carers identified with the GP practice are eligible for a free annual flu vaccination. Next slide, please. So we've seen what sort of stuff can be offered to you if you make your GP practice aware you are a carer. This slide just mentions some of the benefits of doing this. So recognising and identifying that someone is a carer and adding them to the carers register makes it possible for the practice to offer practical things that I've already just explained. So like the health checks and the flu vaccinations, which then helps in turn to maintain the carer's good physical health, mental health. And identifying and registering carers makes it easier for the practice to screen carers regularly for depression, other health problems, which we know carers are statistically more likely to suffer from. Screening and finding problems early means the practice can implement early interventions before things become a bigger problem. Improved carer health and general well-being means the carer is ultimately better able to continue their caring role and feels more able to cope. And also, when a carer is well supported, it means there's less chance of a carer hitting a crisis point and therefore less likelihood of a breakdown in care for that cared for person. Next slide, please. GP practices in Dorset operate differently between themselves as they are their own businesses. Our different communities in Dorset are quite diverse. We have quite rural areas, we have urban areas, and the practice is actually part of that community. The beauty of this is that the general practice can tailor their offer and ways of doing things in order to meet the needs of the specific people and the local people in that community. However, as part of my role, I try and oversee how the practices are doing things and where I can offer ways to standardise how things are done in order for consistency and to share what we call best practice. With this in mind, there will be variation based on what works best for the practice. The carer's prescription pad is a good example of something that I have been trying to standardise for all the GP practices to use. It's something I offer for all the GPs and is a carer identification tool and has been adopted by approximately half of our GP practices in Dorset. You can see an illustration of it on the page here, so you'll be able to recognise it. If you see these in reception or on the GP practice website, they can be filled out and handed to any member of staff in the GP in order to identify yourself as a carer. However, other practices may have their own identification form, but you should be able to ask for this at reception for a copy, and that should be able to make the practice aware that you're a carer. So last slide, please. So just thank you very much for listening, and it was great talking to you, and I hope you enjoy the rest of your day at the festival. Thanks very much.
Thank you, Harriet. That's a really, really informative presentation. I learned a lot from that. Going back to the comments I was making, my poor mother-in-law was a carer of her husband for a long, long time, and sadly they both went into crisis and ended up in A&E on Christmas Eve because actually that early support wasn't there. I do hasten to add they weren't in Dorset, but it's a good example of the support that we can give through those community-based services that hopefully make sure that people stay well in the community, which of course is where we want them to be, in particular in their own home. So thank you for that. We're moving on now to Rachel's presentation. Rachel is going to give the Carers UK presentation this morning. Again, I saw Rachel on the call earlier. Hi, Rachel. Over to you.
Thank you. Yeah, so my name's Rachel, and I am the Senior Research and Policy Officer at Carers UK. And I just wanted to say thank you so much for having me today. You know, it's a real pleasure to be here with you at your Carers Dorset Festival. And I'm just going to talk to you over the next kind of 10 or 15 minutes about like the national picture of caring and what our research has kind of been telling us about carers over the past 18 or so months. A bit of information, a bit about what matters to carers, and a bit about the campaigns that we're running at the moment as well. So this slide just shows kind of the different pieces of research that we pull together to build a picture of caring and what life is like for carers across the UK. So our largest piece of research in the middle of there that some of you may actually have taken part in is the State of Caring Survey, which we run every single year. It's the UK's largest research into unpaid carers, and this year we had almost 9,000 carers fill that out. While the COVID pandemic was at its height, we actually didn't run that. So we didn't run that in 2020, and instead we ran 2 caring behind closed doors surveys, which was specifically targeted to kind of understand carers' experiences of the COVID-19 pandemic, the impact it was having, and how carers were experiencing that. As well as these 2 big pieces of research, we pulled together some kind of smaller bits of data and pieces of information. So the GP patient survey is something that the NHS in England run every year. It goes out to everyone who's registered with a GP to fill in, and so this was filled in by around 150,000 carers and really helps paint a picture of carers' health and also their experiences of primary care and their GP, which ties in really nicely to what we just heard. We also do some research on Carers Week, and we also know a bit about working carers and their employment data. So next slide, please. Thank you. So overall research paints, I guess, quite a worrying picture about what caring is like in 2021 and just the extreme pressures that carers are under. We know that the COVID-19 pandemic hasn't gone away, as we've heard throughout. It's having an ongoing impact on carers, although this might look slightly different to how the impact looked kind of in this time last year. We know that carers' health, wellbeing and finances have been particularly impacted, and that there's been a lack of access to breaks and practical support. But in a more positive light, research also tells us about what matters to carers and what's really important for us to campaign on, and the support that carers would like to see. So this is things like access to better quality care for the person that they care for, access to breaks, being able to look after their own health and well-being, and also a better understanding from the general public and members of health and social care about what it is like to be a carer and about what being an unpaid carer might be like. Just over the next few slides, I'm going to pull out some of the highlights, the key takeaways from our research over the past 18 months. So if I can have the next slide, please. Thank you. So if we cast our minds back to April 2020, it feels a long time ago now. A lot of things were changing. Life suddenly looked a lot different for a lot of people. And we very quickly conducted our first piece of research into unpaid carers right at the beginning of the pandemic. And as you can see, even in April last year, it was already having an impact, with almost 3/4 of unpaid carers taking on more care due to the outbreak. A lot of carers providing more emotional support, spending more money, and carers already worried. So over half, they're already worried about burning out during the pandemic. If we go to the next slide, and we fast forward to September 2020, so 6 months on from that first piece of research, we conducted the same survey again just to see how things were going for carers in the pandemic. And unsurprisingly, I'm sure to a lot of you, and unsurprisingly to us, things had the pressure had only increased. So it'd gone up to 80% of carers providing more care. A lot of those carers for people whose care needs had increased or whose support needs had increased. Almost 2/3 hadn't had a break. And then we also saw the knock-on effect on carers' health and well-being from that as well. So if we go to the next slide, going to have a slightly bigger focus on carers' health and well-being, and this is the information from the GP patient survey that I was talking about. So this report we've actually not published yet, so this is a quick preview and a bit of a sneak peek at what we found from that data in the GP patient survey. Like I said, around 150,000 carers took part. And as we expected from all the pressures, carers facing serious health impacts, this feeling of isolation that had increased during the pandemic. And we also saw that some carers in particular are experiencing poorer health. So this might be younger carers who are providing more hours of care, so more than 35 hours a week, lesbian and gay carers, and carers from ethnic minorities are all having a greater impact on their health than other carers. Thank you. Yeah, next slide. So our Carers Week last year, again, we looked particularly at breaks. Many carers haven't had a break throughout the COVID pandemic, and even carers who were able to have a break were using it, as I'm sure you all are aware, to kind of get practical things done, go and see the GP for themselves. You know, it wasn't a break in kind of a meaningful way. It was mainly done, yeah, to maybe sort out some things around the house, do the shopping, just getting some tasks done, really. And this lack of breaks is really leading to kind of exhaustion, anxiety and stress. So if we go to the next slide. So after kind of all that, I don't want to emphasize too much the negatives, but I think it's important to have a realistic understanding of what caring has been like during the pandemic and throughout 2020 and 2021. But we as an organisation also think it's really important to understand what matters to carers, and this is part of what we ask in State of Caring. We ask carers what their priorities are, and the top 4 for carers are on screen there. So it's around things about better understanding of caring, support to look after carers' wellbeing and their health, increasing the value of carers' benefits, and access to suitable breaks. And something that we really noticed this year was that kind of desire to have more support to look after your own health and wellbeing came kind of joint first, which we've never seen before from the kind of priorities. That's never come so high up and really highlights the impact, I think, of the pandemic. So the next slide, please. As it's Carers' Rights Day, I kind of couldn't finish my presentation without emphasising all the things that carers have the right to. And I'm sure this is something that will come up throughout the day today. And there's also, I'm sure, lots of information from Dorset Council. We have lots of information on our website about all of your rights as a carer. And I've just kind of listed some of the things there that you have a right to as a carer. So you have the right to request flexible working from your employer. You have the right to carers leave, although unfortunately at the moment that's unpaid. Although your employer may go further and offer that paid, that's not kind of a right you have. You have a right to protection from discrimination if the person that you care for is disabled, kind of under the Equality Act. You have the right to request a free flu jab. You have the right to receive a carers assessment. As we've just been talking about, you have the right to be identified as a carer with your GP practice, and you also have the right to be consulted on hospital discharge. So when the person that you care for is being discharged from the hospital, you should be consulted and kind of included in those conversations. So next slide, please. And just to finish off, I thought I'd highlight some of the things that we at Carers UK are doing to kind of deliver on those things that matter to carers and make sure that carers are able to exercise their rights. So I've just chosen a few of the campaigns that we're running. So the first one, Fairer for Carers, is about improving the financial situation for carers. So that is both kind of increasing the amount of carers benefits and also widening the eligibility, because we know that once you reach state pension age, for example, you're no longer eligible for carers allowance. We're also campaigning to make caring the 10th protected characteristic, which will make carers more protected from discrimination and give them kind of more rights, both at work and in accessing services. We were really pleased to see the government bring in the right to carers leave, but we really want to push them and ensure that this is a right to paid carers leave, so that carers have the right to paid time off from work. And as we've seen kind of throughout the presentation, the importance of breaks, and we've really been trying to campaign to ensure that carers have access to breaks. And aside from all of this campaigning, we also provide advice and support. We have an advice line and an email address you can contact as well. If you need kind of more bespoke advice around your rights or about benefits or kind of your health. We have online fact sheets and guidance, we have online meetups, and also a forum, and there's lots more information about kind of campaigns and advice on our website. So if we go to the next slide, I just want to say thanks again kind of for having me here and for listening as I take kind of a whistle-stop tour through some of the research, and please feel free to get in touch with me at the email address that's on the screen there, and I hope you have a really wonderful day today at Carers' Rights Day and at your festival. So thank you.
Thank you, Rachel. Absolutely brilliant presentation. And on a day we're saying thank you, can we say thank you to you and to your organisation? You've really highlighted those two key things, to raise awareness, to campaign. As a nation, we've come a long way, but as we know, there's still a long way to go to make sure that we really recognise and support our carers to the very best that we can. So long live the campaigning, keep up the good work, and we thank you for that. but also importantly, you provide that other aspect, that support, which we've reflected out throughout these introductory comments. Carers are absolutely key in supporting those that they care for, but equally, it's that other part of making sure we support and care for our carers. And again, for me, that's come out very, very powerfully from all the presentations that we've received this morning. So we thank our carers and we thank those who support our carers. So thank you one and all. That brings us to the end of the presentations. Amanda's just posted into the chat bar a number of the workshops that you'll be able to go to. If you haven't signed up for them already, I'm told it's okay. You can click into those. But just before we do, I did want to take any questions. I know there's just a couple of practical matters on the vaccination programme. Sam, you very kindly responded in the chat bar. I just wonder if you could perhaps, for those who may not be able to see the chat, could just repeat the question and the answer to it.
Yeah, thank you, John. I'm just scrolling back up to the chat. So Ord had asked what's happening with the second dose offer for 16 to 17-year-olds. And I think, as Jane was trying to say in her presentation, one of the issues is that as these national offers come out, they've come out thick and fast. And it's really just a case of making sure that you continue to check things like Dorset CCG's pages, where they've got a number of updates that are published regularly around those vaccination offers. And just please bear with us, because the local system's been doing this for many, many months. There's lots of pressures in primary care. Things like the booster vaccination programme, as Jane explained, is largely delivered through primary care at the weekends, but there are also slots available from the large vaccination site, which is now at Kings Park. But obviously there is pressure on those slots because we're trying to continue to do first and second doses, the 12 to 15 programme in schools, which is also offering slots through the Kings Park site, and then all these additional national offers, including things like the third primary dose, the boosters for now the over 40s, and the second dose offer for 16 and 17-year-olds. So it's a bit of a pressure point at the moment, and totally understand that people can be frustrated if you look online and it doesn't appear as if there's anything available near you. But as Jane explained, please do keep checking, because those slots do change, and it's different if you go via your local primary care service versus the national booking service.
Thank you, Sam. Just want to check, are there any more questions? Amanda, have you been just keeping an eye? Is there anything else that...
No, there's nothing else in there, John.
Okay, so can I just again thank on your behalf our speaker this morning. I think that's been an excellent start to the festival. Really lots to think about, but I think some good themes emerging from the discussions so far. So let me talk to you a little bit about the rest of the day. So this session will be finishing a little bit ahead of time, which I did consciously want to do so that you could have some networking time and time to get a coffee and have a chat. So in terms of the bits that happen next, at 10 o'clock, Carer Support Dorset will be running a session, and BCP residents can join the CRISP session at 10 o'clock as well if they wish. If you're already members of these organisations, then you can choose to join those or other sessions. I'm told there are some 29 online sessions for you to enjoy as part of this festival. Gosh, there's more going on than at Glastonbury. This is fantastic, and in a single day as well. What an achievement. So 29 sessions for you to join, and hopefully Amanda's pasted those into the chat bar. So if you need to access them again during the day, if you click back into this link that you've joined, you'll be able to access that chat, so you can then route through into those sessions if you'd like to join them. And if not, do please make contact with the organisers and they'll help you to join up with the sessions that you'd like to attend. So again, can I thank you for your attendance this morning? Thank you for everything that you do. Please do take the opportunity today to really celebrate what you do and the contribution that you make to those that you support and to the wider community. Do enjoy the day. As I've said, this is a day of celebration to recognise that achievement and all that you do to support everyone that you work with. So I hope you enjoy the rest of the day. I'm going to do almost like a sort of this is your life moment. Some of us are now going to trot over to the museum. I'm only around the corner from there, so it's easy for me. And that is where you will get to see and indeed meet Johnny and Tiggy Walker. So for those of you I gave a little bit of a kind of early warm-up to a little bit earlier, you will get that chance later, I do promise you, and we will look forward to meeting them, and those of you who are coming to join other sessions and to do further networking. So again, thank you to everybody. I hope you found the welcome session helpful, and do please tap into as many of those workshop sessions during the rest of the day. Take care, all the best.